Even though the AIDS epidemic continues to ravage many societies in sub-Saharan Africa, there is a widespread feeling that many governments have not done enough in stepping up to the challenges of curtailing its widespread effects. Dr.Zewdie is the director of the Global HIV/AIDS program at the World Bank.
First of all, I want Africans themselves to take this epidemic very seriously. It's something which is unprecedented, it's something which is exceptional, it's something which undermines everything. Africa was on an upward trajectory when this epidemic arrived. So we ourselves need to pay very serious attention to this epidemic. And that does not mean stopping everything else or neglecting other issues. In fact, we should use the opportunity that HIV/AIDS brings to take care of the neglected issues, such as building health systems, such as training more people, such as enhancing the education of girls so that they can protect themselves and protect their families. So where I want to see Africa is there is an unprecedented solidarity, global solidarity, and Africa needs to step up what it wants to do for itself so that it receives this global solidarity and makes good use of it. That's where I want to see Africa.
The worst of the epidemic's impact on many societies will be felt in the course of the next decade and beyond. Its social and economic consequences are already being felt widely, not only in health, but in education and human resources and the economy in general. Dr. Zewdie calls on Africans not to lose momentum in this important fight.
HIV/AIDS is something which people should not get used to, or people should not take for granted. It is a disease, it can be prevented, and because of the availability of treatment, people who are infected can live a normal life. What is killing people more now is stigma and discrimination. We need to care about people who are already affected and infected, and they are, frankly, part of the solution. They are not the problem. And the world has come together in a way which we have never seen before, and we need to keep this momentum.
International AIDS organizations contend that in all affected countries, the HIV/AIDS epidemic is bringing additional pressure to bear on the health sector. Healthcare services face different levels of strain depending on the number of people who seek services, the nature of their need, and the capacity to deliver that care. All these challenges need to be addressed if its effects are to be curtailed. For Voice of America, I'm Mvunganyi.